I'm Gabi, member of the Imago Mall ecosystem in Iași, Romania, and I want to talk to you about blockchain in Biobank. Basically, I want to reimagine how Biobanks works. Right, so let's start. So for the presentation, I have some topics to be covered today. A short intro about me, what is blockchain, how does the traditional biobank work, a few health tech blockchain companies, and the blockchain biobank, and some Q&A. So let's start. This is me, Gabriel. I'm a blockchain developer, enthusiast. In 2013, I had some startups back in the days. Blockchain exchange, then a project that was trying to, deal with emotions in general, social media platform that was trying to reward users using a coin called mood coin, basically trying to remove the good mood that we have. Actually, this is how I met my wife. So yeah, true story. Thank you, blockchain. And now I'm tackling the blockchain in healthcare. So so I have here a quote. Once Charles Darwin said that it's not the strongest of the species that survives, nor the most intelligent, but the one most responsive to change. So I think that if we accept change, we can adapt and we can evolve, at least in my opinion. But let's start to see what is blockchain, right? So blockchain basically is a shared digital ledger. In other words, it's a constantly updated list of transactions. You can think of transactions as financial transactions, data transactions, any kind of transaction. And it is supported by a peer-to-peer network that is either public or private. So basically, you can have a public network, like for example, Facebook, or a private one where you can decide the rules, you can, have your own things inside. And every member of the community uses the same consensus mechanism to verify every transaction made through the network. So basically, you don't need to trust a person, you need to trust the ecosystem and the members inside that network. And basically, this creates a unique and permanent audit trail. You can trace every single transaction that happened into the network, and there's no single point of failure, and there's no way to make modifications to the transaction report. This translates to a server, one central point of failure versus multiple cloud networks, something. And blockchain is the tech behind Bitcoin, Ethereum, and other cryptocurrencies. I think this covers, in a few words, how the blockchain works. Now let's move to how does the traditional biobank work? I think that most of you already know this, but in a few words, a biobank is a type of biorepository that stores biological samples. Usually human. You can think of blood, skin, spine samples, so on and so forth. And it's used in the research. And they have become an important resource of medical research, supporting many types of contemporary research like, genomics and personalized medicine. However, biobanks have provoked questions on privacy, research ethics, and medical ethics. And this, as for May 2018, I think, right? Since GDPR has been implemented, a lot of companies that used to work with data, now they have few problems regarding privacy. Now I want to present to you some health tech blockchain companies that are dealing with blockchain and data and privacy. And here it is. So here we have company, blockchain, the type of objective, and whether they are compliant or not with GDPR and HIPAA. So we have Ongochain. It's a startup from Romania, from Timișoara. They won some really cool, interesting prizes here in Romania and abroad. They do have a blockchain system based on Ethereum. It's a smart contract for electronic health record and electronic medical record. And we have Flatiron. They are not on blockchain, however, they are compliant on SECPHO. They are dealing with oncology based on cloud, care model, oncology, and mixed. Another company is Integra Connect. What is interesting about them is that they introduced a merit-based incentive. So basically, users are incentivized to join the system in healthcare. And also, it's end-to-end patient monitoring, which is really interesting. Another one is Cerner. What is interesting about them is that they have virtual healthcare and they have health information management. And the last one is Emblema. What's interesting about them is that they use blockchain to create a digital token to incentivize users to share data on the platform. So basically, if you're going to donate blood or something, or you can go to a drug trial, your data, it's not, but in some of the cases, you don't receive money for your data. Well, Emblema managed to create a token to reward their users. Now let's move to how blockchain biobank could work. But first, why? Mainly because 93% of medical data is lost due to human error, system error, so on and so forth. There are still in the world, at least here in Romania and Iași, we still have hospitals or small hospitals that they don't have like any electronic system, record system whatsoever. They are still using pen and paper, and this is really sad, honestly. And of course, there are a lot of factors like no use case for research current EHRs, no interoperability, no integration, and no personalized care for the patient. But let me show you some blockchain advantages for healthcare. For example, we have like fast access to data. Given the fact that there is no central server, you can access data on any server. You have security inherited by the blockchain tech itself. You have data integrity, given the fact that there is no database, there is no, data cannot be corrupted. You have patient privacy. There are blockchain systems that are natively dealing with privacy, because you cannot be traced, which is important in health. And there are like some other things. Thank you, Ongochain, for this. And here it's like a small scheme how blockchain could work. Embedded with yeah, awesome. I will be on time. You share the data, you donate blood, for example, and mobile and fixed biometric collection documentation on blockchain. Basically, we can create a digital asset out of your blood sample, and that is stored on the blockchain. And benefits, there are like a lot of benefits, like you can trust with donors, we improve the transparent process of records. You can you have connected storage that will translate into smart storage. You can have like a blockchain currency that can be introduced and be used as an incentive, so on and so forth. And what we want here as member of the Mode, we're looking for partners to start this and apply to DIGI-B-CUBE prototyping voucher. Myself as a blockchain developer, Mode as a cluster in Romania. So if you have questions, I'm more than happy to answer to them. You have my email address here. You can contact us via webmail. And of course, the presentation will remain, so you can take a look. Maybe you find it interesting. And thank you for having patience with me. Hope you're fine and stay safe, and talk to you soon. I think that there's a minute. Thank you.
Thank you very much